Valerie Hoon here, Director of the Department of Mental Health. So it's been a rough 2 years. March 2020 to today, we've learned a lot together. We've overcome a lot together, whether that was scrounging up masks, becoming vaccination partners for an entire system at the Department of Mental Health, testing partners, to struggles we face with the workforce today. I have to say thank you. The last 2 years have been tough. The next 2 years with the challenges we have with the workforce don't look to be any easier. But we are so gracious for all the work that everyone has done, for all the innovation that everybody has helped to spur, the good ideas, the creative solutions, and the drive to continue to find more of those things. We're going to need more of that in the next 2 years as we deal with probably the largest workforce shortage we've ever seen. And we can't imagine better partners than everybody here. Thank you again for everything you've done, and see you in the future.
I'm Becky Geer, and I'm the Director of the Office of Disaster Services for the Missouri Department of Mental Health. I've been doing disaster services since 2016, and I've been with the Missouri Department of Mental Health since 2006. During the pandemic, the Office of Disaster Services did several different things. We were involved with a lot of different ways for the response, including, handling PPE, tracking COVID cases, coordinating deployments, hosting and writing after action reports, writing grants, providing trainings, a lot of different things that were happening. But overall, our goal was to support the behavioral health providers and the developmental disability providers however they needed. So Office of Disaster Services worked with our state, our local, and our federal partners like the State Emergency Management Agency, the Department of Health and Senior Services, FEMA, SAMHSA, as well as all of our local partners, including behavioral health partners and developmental disability partners. I have been so impressed by the response that I've seen across the state during these last 2.5 years, especially during these unprecedented times. This pandemic has been historic in so many ways. I've worked a lot of different disasters, and I will tell you, there's never been one like this disaster. And so I have to just say thank you and express my gratitude to each and every one of you watching this, because you guys have done an amazing job in just keeping yourselves and your individuals that you work with safe, as well as making sure you're taking care of what you need to do day in and day out, and working long and hard hours. So thank you for your hard work and your commitment and your dedication. It's greatly appreciated, and it does not go unnoticed. I did want to mention a couple things that the Office of Disaster Services had the pleasure to do during COVID with behavioral health providers. And two of those things were working with our behavioral health strike team and working our crisis counseling program. So during 2020, we were asked to deploy our behavioral health strike team partners to the St. Louis area to work 2 sites. We were asked to supply behavioral health support at the alternate care site and at the Dignified Transfer Facility. And these were not easy places to provide behavioral health support. And so 3 agencies, BJC, Comtree, and Compass, stepped up to the plate and were able to get staff out there and worked long hours at both of those sites. So thank you to our behavioral health strike team members who were able to provide that support. In addition, for the first time ever, we stood up a crisis counseling program grant through FEMA and SAMHSA that we were able to provide services across the entire state of Missouri. First time that's ever happened. 24 provider agencies across the state stood up to provide those services. We did this for 2.5 years. That is historic, that has never happened, and we were able to reach 4.5 million Missourians through those services over the 2.5 years. That is incredible. Our goal was 930,000 people to reach, and we reached 4.5 million. And that's from all the hard work that each and every one of you have done. So again, I know I've said it already, but I just need to thank you for your commitment, your dedication, and all the hard work that you've done. Keep doing the amazing job that you're doing, and know that we at the state level greatly appreciate each and every one of you.
Hi, Nora Bach here with the Department of Mental Health. I'm the Director of Behavioral Health Division. I can't believe that we're actually reflecting back on 2 years, and it's amazing to me to think about where we've come and the types of things that we talk about now that we didn't think we'd ever have to talk about. In my vocabulary, scrappiness is a compliment, and I think I'd like to share that my opinion of our system is that we are scrappy. We did what we had to do to get things done, to take care of people, to meet their needs, to take care of our employees. I've come to understand just how deeply people are committed to their communities and to those that they serve. I know Director Hoon talked about the creativity. It's definitely that, but that comes from a source fueled by passion. And I'm so grateful that we are in a field and in a state, more importantly, where our relationships with each other, we look out for one another, we assist each other, and we try to come up with great solutions. And often it's on the fly because things changed rapidly, sometimes daily, especially early on in COVID. So I just want to, again, thank you. I don't think we can do that enough. I don't want it to ever become routine or unmeaningful, but so I really want you to understand that it's just with incredible gratitude that we continue to partner with you and on to the next challenge, whatever that may be. I know that we can get through it together.